I want to invite my dear friend Dr. Chandrakant MV for the last presentation from Kolkata on EV302. Please take us through, sir.
Thanks, Dr. Nagendra, and thanks, sir, for this opportunity. So I will take you in 5 minutes through EV302. What happens if there is Nectin-4 expression in a urothelial carcinoma? So we all know what is Enfortumab Vedotin. Enfortumab is a fully human monoclonal antibody against nectin. Nectin is a cell adhesion molecule that is expressed in bladder. And Vedotin is MMAE, monomethyl auristatin E, which is a microtubule poison. And the drug antibody ratio, the payload is 3.8. Okay. So for TDXT, we know it's around 8:1. Here it's 3.8:1. So these are the EV trials we have. EV301 is post-chemo IO. In later line, if you give Enfortumab Vedotin, the OS improves from 9 to 12 months. And EV302 is first line, where the PFS doubles from half a year to 1 year, and OS doubles from 1.5 years to nearly 3 years. So there is almost doubling of survival with EV301, EV302. So what is nectin? Nectin is a cell adhesion molecule that is there in urothelial cancer cells. It is expressed in around 90% of them. So does nectin expression correlate with Enfortumab responses? This is what we would understand. So nectin basically maintains cytoskeleton, and the type of IHC scoring they use is the H score. So they use these two cutoffs of 150 to 225. So this is the EV302 exploratory analysis of Nectin-4 expression, and does it predict outcome with Pembro EV. So nearly 800 out of 886 patients did have data about Nectin-4 expression. So what you can note here is the median, so the Nectin IHC score is called the H score. The median H score is 280 and 270. That means it is high. It is above 225. Above 225 is considered high. So majority of patients had high H score. Means a lot of nearly 75% patients, 77% patients expressed a high Nectin-4. That means urothelial carcinomas are Nectin-4 rich or Nectin-4 expressing tumors. Again, this is whether you biopsy from the primary or from the metastatic site. The metastatic site had a numerically higher nectin expression, but both had more than 225. That means it was a rich nectin expression. So what they understood is that they took a cutoff of 275, less than 275, more than 275. They looked whether the benefit of Pembro EV is better if nectin is higher. So it doesn't matter whether you have a low nectin expression or a high nectin expression, it benefits in all subgroups. Similar OS benefit also, it doesn't change based on the amount of nectin IHC expression. As you can see, whether it is less than 150, 150 to 225 or more than 225, the benefit is consistent, and nectin expression by IHC is not predictive of response to Pembro EV. Even the response rates are independent of the amount of nectin expression, right? So then what is predictive? So nectin IHC is a protein expression on the cell. So what if you look into Nectin-4 gene amplification? It is predictive. So there you saw 90% of them had nectin IHC expression on the cell, whereas Nectin-4 gene amplification by NGS is seen in 1/4 of urothelial carcinoma. So if gene amplification is identified, then the response rate is 96 versus 32%. So Nectin-4 gene amplification is predictive of excellent response. And if it is not amplified, still you have 32%. But Nectin-4 gene amplification is better predictive than IHC expression of nectin. So conclusion is Nectin-4 by IHC in urothelial carcinoma is seen in 90% of urothelial carcinoma cells, and Nectin-4 and PD-L1 by IHC is not predictive of response to immunotherapy or Pembro EV. So they are not biomarkers to decide whether to give Pembro EV or not. However, our Nectin-4 gene amplification is predictive of excellent response to Pembro EV. Thank you.